Now to the latest on the COVID-19 pandemic here in Indiana. The 7-day rate of positive cases has dipped slightly to 9.3%. 44 new deaths were reported between October 6th and October 11th. And as of today, 56.5% of Indiana's eligible population is fully vaccinated. Breakthrough cases of COVID-19 account for an extremely small number of those fully vaccinated Hoosiers. WRTV's Nikki Dementri spoke with a local doctor to learn how vaccines are working in the fight against COVID-19.
Nothing is perfect. That's the line Dr. Warren Gavin, who's a hospitalist at IU Health Methodist Hospital here in Indianapolis, told me when I talked to him about breakthrough cases and coronavirus. Now, Dr. Gavin says vaccines aren't 100%, but these breakthrough cases should not be a cause for alarm. Take a look at the data from the Indiana Department of Health. Breakthrough cases account for 1.3% of all fully vaccinated Hoosiers. When it comes to hospitalizations of those breakthrough cases, that number is even smaller, 0.027%. Dr. Gavin says, yes, he does have fully vaccinated Hoosiers with COVID on his floor, but he stresses the majority of his caseload is unvaccinated individuals.
The breakthrough cases seem to fare better in terms of their hospital course. So, for example, a breakthrough case may come into the hospital and need oxygen for a day or two. We give them certain medications and they seem to turn around and go home and have a better clinical course than those who are unvaccinated. So, for example, when we hear someone's unvaccinated in the hospital, you get a little more nervous because you know that they're may have a rockier course and are much more likely to decompensate and go to the intensive care unit.
Dr. Gavin says those at the greatest risk for these breakthrough cases are immunocompromised individuals.
Nikki, you profiled Dr. Gavin over the summer when his COVID caseload was starting to rise. What is he hoping for today as numbers statewide start to drop again?
Ultimately, Nicole, Dr. Gavin wants to see more and more Hoosiers become fully vaccinated. This is what his med-surg floor looked like back in August. The yellow carts you see here designate a COVID positive patient. And at the time, more of those carts were lining his hallways. He says now numbers are dropping, but he'd like to see them back to where we were several months ago, when transmission was low across the region. Another question I asked Dr. Gavin today, why should those who are unvaccinated get the shot if some vaccinated people are getting COVID-19?
I've heard that a number of times. And, going back to some of the numbers, that I was talking about, I think the simplest way, even outside of numbers, the simplest way to think about it is that the vaccine's not perfect. No one's ever said that if you got the vaccine, you're not going to get COVID. You're not going to break through. There's no chance. But what I can definitively say is that you're much less likely to get COVID after being vaccinated and much less likely to become very ill.
Again, Dr. Gavin and other experts tell me they cannot stress enough the importance of becoming fully vaccinated, not only to protect yourself, but to protect others. Nicole?
Nikki, thank you. And you can sign up to get vaccinated or find a clinic, since many are accepting walk-ins at ourshot.in.gov or by dialing 211.